Within the Graduate School of Information Science and Health, we truly aim to break new ground.
Medicine and the entire healthcare field are currently undergoing substantial changes. Advances in molecular life science, biomedical sciences, and engineering have significantly influenced diagnostic and therapeutic options. Also, demographic and socio-cultural changes, together with increasing cost of diagnostic and therapeutic procedures, have put our health systems under severe pressure.
Informatics and computer science will be instrumental in this transition process because they will provide the applications, the methodology, and the services for future medical environments.
We are convinced that collaboration across disciplines is essential. Information transfer is needed from bench to bedside to communities and back. Our aim is to train a new generation of researchers with methodical skills in both informatics and biomedical sciences.
Within our graduate school, we aim to define a new approach and overall concept for education and research in health by emphasizing these needs. We aim to educate a new breed of researchers, which we will train in both the disciplines of informatics and medicine.
The interdisciplinary graduate school links the two Munich universities with the two university medical centers and the Munich research institutions such as the Helmholtz Center or the Max Planck Institutes. On an international level, we have very close cooperation with the Johns Hopkins University Baltimore or the Harvard University, or also the Imperial College or the University of Tokyo in Japan, only to name a few.
To meet the aims of our school, we have identified 4 research areas for collaboration between medicine and informatics and related sciences, which are closely intertwined. Bioinformatics and systems biology, informatics for biomedical engineering, health informatics and e-health, public health informatics and public health.
Doing a doctorate with the GSISH is for me not only an opportunity to do a great work, but also make a contribution that matters. In our project, we are developing cutting-edge methods to detect skin diseases early and improve the quality of life for as many people as we can.
Our group on biomedical physics, we are essentially working on new concepts to improve imaging, in particular for biomedical applications. The integration into the GSISH graduate school for us is the interdisciplinary approach, which we can hardly find if we are sitting alone in our faculties, which is physics for us in particular.
Our research group at the TUM is working with magnetic resonance imaging techniques, a technique which uses very strong magnetic fields, as we have seen here in this laboratory. And for that purpose, our PhD students from the graduate school are working in these projects together with colleagues from industry and from the university.
In addition to the scientific training, Graduate School of Information Science and Health puts a strong emphasis on a comprehensive PhD education. As such, we also support our doctoral candidates' international research stays and provide them with tailor-made practical and transferable skills training.
The interdisciplinary environment and networking provided by GSISH enabled the doctoral candidates to face scientific challenges with focus on future application and thus a unique chance for comprehensive research.
With GSISH, I have great independence and flexibility in conducting my research compared to other types of PhD funding. Also, it's important for me to take part in conferences to get to know about the latest innovations in my field, and for that GSISH provides me with substantial funding.
I'm a physicist working here in the nuclear medicine department, and I'm supervising students in the graduate school, and I really enjoy this work because I think they get a real truly interdisciplinary training here in the hospital, because they work together with the medical doctors as well as with the engineers. It can be really tough because the original idea may not work in the final application. But if you really make those last meters until your idea gets into application in medical diagnostic, it is really rewarding.
When I received my diploma degree in physics with a focus on medical imaging, I wanted to stay in research and become a member of a PhD program. With the medical background and the good contacts into the healthcare industry, GSISH was a clear choice. To me, the biggest advantage of GSISH is the interdisciplinary and structured approach. Right in the beginning, my supervisors and I outlined a plan, including milestones for my project to be finished in 3 years' time.
I chose to start my PhD at GSISH because multidisciplinary, multicultural, healthcare-related project in a high-ranked technical university was exactly what I was looking for. In addition to setting up strong ties and close connection with university and hospital, I considered additional GSISH workshops, project management and recreational program to be excellent experiences for my future.
In a way, I envy them because they have 2 supervisors and they really work together with those interdisciplinary teams.
In the next years, we will have up to 60 PhD candidates who will contribute to strengthening the research platform in Munich and Bavaria, and we are also building up a lively community of alumni who will also contribute to strengthening medical research in the future.